Coming up on the Doctor's Hospital podcast.
You're sweating a lot. Mix that with bacteria, mix that with all the oils that are going on, and that leads to clogged pores.
All of our products are non-comedogenic. They don't clog the pores, and some of our products have sunscreen in them.
Doctor's Hospital Specialist Clinic is where trusted and best care meets consistency and dedication. Let our expert specialists take you on a healthcare journey where warmth, compassion, and your well-being come first. From diagnosis to prescription, we are with you every step of the way, ensuring your peace of mind. Visit us today at Centerville Medical Center, Collins Avenue and 6th Terrace, and discover quality, compassionate healthcare at Doctor's Hospital Specialist Clinic.
Welcome to the Doctor's Hospital podcast. I am your host, Alexis Burrows, Marketing Director at Doctor's Hospital. And today I'm excited to be joined by dermatologist Dr. Ormanda Johnson and Mr. Aaron Pinder of Perfec-Tone. He's the CEO there. And we are here to talk about a very interesting partnership that Doctor's Hospital has entered into with Perfec-Tone as a part of our dermatology offering at the hospital. So welcome to the show, both of you. We're happy to have you on.
Thank you.
Thank you.
All right. So, let's start at the partnership because there's a lot of different, corporate synergies that happen all over the place. And so I'm interested in finding out, what does the partnership between Doctor's Hospital and Perfec-Tone look like? What can people expect to get out of this engagement? And what are some of the benefits from both sides in terms of interacting with the other? So we'll start with you, Dr. Johnson, and then we'll go to the CEO.
Well, thank you. So I am excited about this partnership. So like you say, I'm the dermatologist at Doctor's Hospital. And as a dermatologist, I'm the medical doctor who specializes and treats disorders of the skin, hair, and nails. But of course, dermatologists partner all the time with estheticians, those who can offer complementary services, be it medical grade facials, be it microdermabrasion, etc. And Mr. Pinder's company, which is Perfec-Tone, we've decided to partner with, and it's the perfect company we find. It's been around for many years. It's reputable, has great products that are being proven to be effective, and like I said, can offer complementary services.
The audience, that doesn't mean free. Services that align well with what we offer.
Absolutely.
So from your perspective, Mr. Pinder, what is the partnership look like? And what are some of the things that people can expect from the engagement between both entities?
Yeah, so Perfec-Tone was looking for a partner for a lot of years because we've been open from 1980. So we're one of the first in the world to tend to people of color as well. So for the past 44 years, it's been difficult to find somebody that is ideal as a dermatologist, and Dr. Johnson is the perfect one to partner with Perfec-Tone. So what we wanted to do was to showcase ourselves as the experts in skincare, to have the partnership to tend to every skincare needs, because there's customers that may be under Perfec-Tone that will go to Dr. Johnson and vice versa. And we always recommend to different places, but it would be nice to have a partner that we could recommend specifically and we want it to be a one-stop shop. So no matter what skin concern that people may have, they could come to either Dr. Johnson and I, and we can tend to them. If they need to swap to different sides, we could tend to them for whatever skin concerns.
So what would be, I guess, an instance where someone may interact with you, Dr. Johnson, and then there's an accompanying service from Perfec-Tone where they would be able to kind of slide into, and then vice versa? Like, how does someone know where, if they're seeing an esthetician, where it escalates to a point where, okay, it needs to then turn into, I need to see a dermatologist? So we'll go with Dr. Johnson and then Mr. Pinder.
Well, thank you for that question. So let's take, I think, the most common skin disorder that I see, and that's acne. Those are having acne flares. So it might be so that these might be in the mild to moderate group where I treat, be it with topical products or be it with antibiotics, etc. But they might actually need extractions, or they may need medical grade facials to go along with that. And that's where partnering with Perfec-Tone with Mr. Pinder's company will come into.
Okay. And then same thing. So in reverse, where is the point at which it says, okay, we've kind of done all we can, and now we need to kind of partner with the dermatologist to say you need to take it a step further.
Right. So there may be customers in instances that may have lesions that lead to hyperpigmentation. So there's things that we could deal with in regards to the hyperpigmentation side to help lighten them up while we send the lesions over to Dr. Johnson.
Okay, understood. So, obviously we live in a very hot country. We've been, running a promotion for a little while with you, with Perfec-Tone and the accompaniment of Doctors Hospital. You talk about it from a summer perspective, but I mean, we're essentially eternally summer around here. So kind of looking at some of the issues, from the dermatology perspective, what are some of the most common skin issues people face in a climate like ours, especially in the hottest months of the year when you're talking, August, September, July, August, September, that sort of space, and how can they be prevented?
So there are a lot of skin conditions that occur or worsen during the summer months.
Mm-hmm.
It's hot, it's humid, and the most common one, again, I'd say, is acne breakouts.
Okay.
You're sweating a lot. Mix that with bacteria.
Oh yeah, from the heat.
Absolutely. Mix that with all the oils that are going on, and that leads to clogged pores, which will lead to acne breakouts. So the thing that you can do one of the things you can do to prevent it is look for products that say non-comedogenic. And that means it's just that products that do not contribute or cause breakouts.
Okay.
So you can look for that in your makeup products, maybe your skin care products. And it mightn't just have that word. It might say oil-free, or it might say won't clog pores.
Okay.
Another common thing is, remember, acne, people think it's only on the face. Acne can occur in other parts of the body, be it the chest, the back, and the shoulders. And a common thing that you should remember is, let's say you're out there, you're sweating a lot, your clothes, friction could cause more irritation. So you want to get out there and change those sweaty clothes as often as possible, or as soon as possible. Another thing too, you're wearing your hats. You might be wearing headbands. You want to not wear them. The following day, you want to wash them.
Right. Yeah. Okay. Understood.
And there are other skin conditions. Let's take melasma, a common one that us women face.
Okay.
And melasma is when you have these dark brown patches, or could be gray depending on the skin tone. On the face, could be primarily on the forehead or the cheeks. And it really gets worse with the summer, with sunlight. So you really want to protect your skin from the sun.
Right.
And that's where sunscreen takes a place.
I was going to say, so you mentioned, some of the products and being like non-clogging and things like that. Does that also apply to like your sunscreen and those products as well? You're looking for something that is oil-free in that sort of skincare as well?
So that can apply. So there are two types of sunscreens, and that's a common question I get. What sunscreen should I use? And I always tell patients, use the one that works for them. Okay. But essentially, there are two types. You have your mineral sunscreens, and then you have chemical sunscreens. So I always say for people probably with more sensitive skin, stick with more of the mineral ones, because they only contain two ingredients, zinc oxide and titanium dioxide. And how mineral sunscreens work, they basically deflect all those harmful UV rays that come and can damage your skin. Whereas the chemical sunscreens work where you put it on and it forms a coat, and it's almost like a sponge where it absorbs the very harmful UV rays. So it doesn't penetrate the skin.
Into the skin, right. Okay. Makes sense. We live in a climate where it's almost all sun all the time. How does increased sun exposure affect different skin types? So whether that's, sensitive versus somebody who may be acne prone, or someone who has melasma, is the difference in sun exposure kind of change how people's skin react?
I would say you have different skin types, like you said. All right. And I would go more with skin tones and skin types.
Okay, fair.
In terms of darker skin tones have more protection because you have more melanin, more pigment. So it's much harder to burn, to go into sunburn, which can lead on to sun damage, that can lead on to skin cancer. As opposed, lighter skin now is more susceptible to having sunburns and leading on to more sun damage. But what I tell people are, everyone, no matter the types or no matter the tones, everyone has skin. And the leading thing that you can do to protect yourself from any damage is sunscreen, sun protection.
So that's even if that is not just if you're going to the beach or going to the pool. This is just in the everyday.
So Absolutely. And so one of the things that I want to drive home is because people think once it's sunny out there, you need to apply sunscreen.
Mm-hmm.
I want people to get into the mindset that sunscreen should be used daily and year round. Even when there's cloud coverage, even when there's rain and you're thinking there's no sun out there,
Mm-hmm.
you have those harmful UV rays, that UVA and UVB rays that can penetrate even through the thickest cloud. So you need to use your sun cover or sunscreen
Mm-hmm.
year round.
Okay. So whether you're going to the beach or not, it's something that you should apply. Because I know I've seen like makeup brands have like SPF whatever in their brands and things like that in different products.
Mhm.
So okay, that's good to know.
So, but I just want to lead on to that though,
Mhm.
and because that's another common question that I get. My makeup has sunscreen in it.
Mhm.
So do I need additional sunscreen? And for the most part, yes. Because what happens is when you're looking at sunscreen, it always has a number on it called
Mhm.
SPF, the sun protection factor. And basically that's just a measure of how well it protects you from getting sunburns. And the higher the SPF, the more protection you get from those UV rays.
Right.
So the thing is with your the sunscreen that might be in makeup mightn't be as high because you need to have that number, that SPF of 30 or higher.
Mm-hmm.
So makeups generally sometimes have much less.
Oh,
And the
interesting.
thing is too, if you're not really using a thick amount cover of your makeup, you're not going to be getting as much protection.
Right.
So a SPF 30, it's found that it actually shields you from about 97%
Mhm.
of those harmful UV rays.
Mhm.
So daily using it. And
We are having a great conversation with Mr. Aaron Pinder and Dr. Ormanda Johnson, talking about all things skincare related and the partnership between Doctors Hospital as well as Perfec-Tone. So we'll take a quick break for some word from our sponsors, and we'll be right back on the Doctors Hospital podcast.
Are you seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctors Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Welcome back to the Doctors Hospital podcast. We are continuing our conversation with Mr. Aaron Pinder, CEO of Perfec-Tone, and Dr. Ormanda Johnson, dermatologist here at Doctors Hospital, about skincare and the partnership between Doctors Hospital and Perfec-Tone.
that sunscreen on, you're washing your face, and then applying your sunscreen, and then applying the makeup on top of it.
Okay, understood. We talk about the nature of how your skincare routine may change as the seasons change, right? So as you go from like spring into summer or summer into fall, how would a skincare routine change? Kind of understanding those transitions. Like, is there a need where you use less protection, more protection? How does that kind of apply, and how does that change?
So I think the biggest change that you can do is actually lighten up your moisturizer. So moisturizers, you can have very thin moisturizers, and then you can have the thicker oil-based or petroleum-based moisturizers. So I would steer away from those, the ones that are more petroleum-based, because they're going to be hot and they're going to be sticky, and you're already, sweating a lot. So I would steer clear of that. Another thing too is, sometimes retinoids, again, these are vitamin A skincare products that you use. You can use it for acne. You can use it for help you with fine lines. And I'm not saying not to use it, but it's just that your skin is going to be more inflamed and irritated if you use it in the summer. So what I always tell my patients are, use it in the evening, use it in the nighttime, and you have to apply your sunscreen in the morning. And another thing I just want to pick up on that we didn't say is sunscreen. Of course, you're putting it on before you leave the house, and you're going to have to reapply it every 2 hours or after you swim or sweat.
Okay. Yeah, I know we had a conversation a few weeks back with Dr. DeVoe, the pediatrician, talking about that process of reapplication and need for it, and how it's something that we often miss. You go, whether it's to the beach or if you're asking people essentially to do this, even if you're going into the office. So it's like by the time you go out for lunch, you may have a need to reapply because you've been sitting in the office and now you're going back out into the sun again and there would be a need for reapplying even in that sort of space.
Absolutely.
You know, one of the things you hear people always talk about with skin is like, dry skin, oily skin, moisture, all of these different things. And that kind of thing leads to kind of the natural question of what is the relationship between hydration and the health of your skin, especially, I guess, around, like again, in a climate like ours, it's always kind of hot coming out of summer. What does that look like?
So water is probably the best thing you can do for your skin. I mean,
Mhm.
water does so much. It flushes out toxins, but in terms of the skin, it really helps with the elasticity.
Mhm.
All right. So during the summer, you really need to drink adequate amounts of water. This is going to keep your skin well hydrated. It's going to help you not have that dullness, not have the flakiness, the irritation that you get. And it's going to keep and maintain all the moisture in your skin.
Okay. You mentioned this a little bit earlier, and I wanted to kind of circle back around to it. Sometimes you don't do a good job with your sunscreen or the reapplication, and you end up in a position where you have sunburn, things like that. What are some effective remedies for sunburn and preventing long-term damage from sun exposure?
Right. So sunburns obviously can lead eventually to not just skin cancers,
Mm-hmm.
but also premature aging, age spots, fine lines, wrinkles. So you really want to do that sun protection and not just the sunscreen. You want to seek shade as best you can. You
Mm-hmm.
want to wear your wide brim hats, your sunglasses. And I know it's hot, but if you could, the long protective clothing,
Mm-hmm.
you know, and that's one of the things. But unfortunately, if you do develop sunburn, then that's something that you need to treat. And the best effective way is to take either very cool showers or bath,
Mm-hmm.
or to apply a cool towel onto the skin.
Mm-hmm.
And as soon as you come out, within about 5 minutes, you want to gently blot that skin
Mm-hmm.
and then apply a good moisturizer. And particularly for sunburns, moisturizers with aloe vera really help to soothe that skin.
Mm-hmm.
Of course, if you go on to develop blisters, a
Mm-hmm.
key thing that I want to say
Oh boy.
is do not pop or fool with those blisters.
Mm-hmm.
You need to just naturally let them heal, because if you do, that can lead to scarring. It can lead to skin
Infection.
infections.
Mhm.
Absolutely, which then is so much harder to treat. So just leave the blister intact. You can put petroleum oil, and that's the time you can use the petroleum oil to
Mhm.
soothe that sunburned skin.
Okay.
Mhm.
Awesome. Talking through this, I understand obviously Perfec-Tone is a place that offers both products and services. So what are some of the products in your space that would be helpful, kind of based on some of the advice that we're getting from Dr. Johnson, where they would fit in to say, well, we offer this particular type, or like thinking about the SPFs and that sort of thing. Where does that fit in with you? And then even just based on the relationship that we have, what are some of the discounts or benefits that people can get, if they're coming from Dr. Johnson to you or vice versa?
All right. So the biggest thing with Perfec-Tone is that our formulation, our ingredients are very intentional.
Mm-hmm.
So we have all of our products are non-comedogenic.
Mm-hmm.
They don't clog the pores, and some of our products have sunscreen in them.
Okay.
Like Dr. Johnson mentioned, we always tell our clients it's basic, and you should still always apply your sunscreen in the morning. We have different products that we offer too, including like mineral sunscreen.
Mm-hmm.
Other than that, you have the different products that all work together and deal with multiple benefits for the different skin types to deal with different skin concerns.
Mm-hmm.
Now, when it comes to the different offerings that we offer, we have a 10% discount due to this partnership.
Mm-hmm.
Anybody who comes to either of us, whether it's Dr. Johnson or Perfec-Tone, can get 10% off at the others. And
Okay.
Dr. Johnson also has some great self-pay options too if you're paying out of pocket. So you could get the 10% off in either side, and you can really gear your skincare routine now, because as you mentioned with summer, that's when all of the oiliness starts. That's when the skin gets clogged, and that's when the skin problems usually start.
Okay.
So that's why at the beginning of September, October, you really see a lot of people start to develop acne. So it's really good to start from now to get your skin clear, to get your your pores unclogged. and to get into that proper skincare regimen.
Okay, awesome. Sounds good. So I guess, are there any other details about the partnership that either of you want to say, and then kind of, let us know where people can get in contact with you, where where they can get in contact with Perfec-Tone to find out more about the partnership or some of the services and products that are being offered.
So absolutely. So like Mr. Pinder said, for the month of September, we're offering a 10% off on initial Perfec-Tone visits. And the reverse is we're offering 10% off on the initial dermatology consults for our self-pay patients, and those with insurance, the co-payments are waived. Once the deductible is met.
Mm-hmm.
And you can contact to book an appointment with myself, Dr. Ormanda Johnson, at 302-4710 or 302-3321, or book online at www.clinics.doctorshosp.com. And Mr. Pinder, you can find your contact.
Right. So for Perfec-Tone, you can either reach 603 Skin or you can WhatsApp 828 Skin.
Okay.
Awesome. 7546.
All right. And you guys are located where?
Carmichael. Okay. In that new plaza close to Southwest.
Okay, awesome. All right, sounds good. So thank you very much, both of you, for taking time out of your busy schedule to talk to us today. Obviously, if you are listening and you have any issues with your skin, feel free to start at either side of the equation. Obviously, there's a partnership here where if you need to, you can, pass on from one to the other. And this is, I think, our second engagement with Dr. Johnson on the podcast. So happy to have you back on. And hopefully, again, another set of interesting information for our listeners. And hopefully they get a lot out of this conversation and understanding what it is that we're offering with Perfec-Tone. So thank you both for taking time out of your schedules.
Thank you.
Thank you.
All right. And for our listeners, as always, we invite you to like, comment, subscribe, and share. And we will see you back here next week on another episode of the Doctors Hospital Podcast.
Your health just got brighter with Lamp Insured. Sign up for Doctors Hospital's Lamp Insurance Supplement Plan and enjoy copay waivers and complete access with no upfront ER or inpatient collections. Only $30 per month. Visit doctorshosp.com/lamp to sign up or contact 242-822-1009. That's 242-822-1009. Your journey to affordable and worry-free healthcare begins now.